We're going to have the whole section talking about deficits, and we can talk about the changes in Medicare. We were trying to focus on costs related to lowering families, and the only concern I've got is, look, if every speaker, at least on one side, is going through every provision and saying what they don't like, it's going to be hard for us to see if we can arrive at some agreements on things that we all agree on. So I don't want to try to cut you off. Please finish up, but I just want to kind of point out that
I do want to say on this issue on premiums, CBO in their letter on page 4 does say that the estimated average premium per person for non-group policies would increase by 10 to 13%.
This is the discussion that I just had about Lamar.
Yes, they do say that, and they do say that the value of the benefit is higher, and that is why it goes up. But the reason the value of the benefit is higher is because of the mandates contained in the legislation. And this is one of our big concerns with a lot of the issues that have been raised. Yes, we have similarities, but when all of this is structured around a government-centered exchange that sets the standard for these policies, states can't get out of these requirements unless they seek a waiver from the Secretary. That kind of approach raises costs, and so both of your comments were correct that costs do go up, and it's because they have a richer benefit, but the reason it's richer is because of the mandates contained in these very large bills.
Okay, I'm going to let Rob, feel free to respond to anything that Dave indicated or to any of the other issues that have been discussed.
Thank you, Mr. President. I want to thank my friend Tom Coburn and John Klein for the spirit of conversation which they offered and try to carry that forward a little bit. The President asked at the beginning of this, what ideas do we share about cutting costs? And Tom, I think you had some very good ones. Fraud, that the President has a proposal that says we should have a database. If you've committed fraud against Medicare once, you can't make a contract again. Wellness, there's a lot of good ideas in the bills. Junk lawsuits, I think that there's what Secretary Sebelius is doing is very important in curtailing that. And then the President asked the question about whether we can find agreement on pooling the purchasing power of small businesses and individuals so they can get the same deal that big companies and members of Congress get. And my friend John Klein talked about the Association Health Plan proposal. Respectfully, John, I think that what you're talking about with association health plans and what we're talking about with exchanges is a semantic difference. It's a matter of pooling the purchasing power of small businesses and individuals to get a better deal. But there is one substantive difference that I want to ask about because we are concerned about it. If we can resolve this, I think we could agree. Let's take the case of a woman who has a baby by C-section. And she lives in one of the many states that say you can't be kicked out of the hospital after you've had a C-section until your doctor thinks it's time for you and the baby to go home. Now, under the Association Health Plan proposal, that rule wouldn't apply to that lady and her baby. That there would be no protection of her in that situation. We think, John, that there shouldn't be necessarily, 51 different rules for each state, but there ought to be some minimum federal standards in these exchanges to protect people in cases like that. So I think the issue is if we could find a way to agree that in a case like this where, a lady has a baby by C-section and has the ability to not have the insurance company get between her and her doctor, so the doctor makes a decision about when they go home, we could figure this out. And how do you feel about that?
If I could just respond to that, my friend knows very well that there are large companies today who operate under what I'm proposing for association health plans. They get a waiver. They don't have to comply with the individual mandates of all 50 states. And I don't hear people complaining about the insurance policies that they're getting from their big companies. In fact,
we do.
Many of those now would fall into what we've been calling Cadillac plans because they provide very excellent service. So I think that, frankly, is a red herring. And I think that you're not going to have adequate coverage if you have an association health plan that's working under the same rules as a large company.
But John, would you favor a standard that says they have to do something like that, or would we just leave it up to the insurance company?
I would say that we put the association health plans in exactly the same position that large companies are today, with exactly the same rules under ERISA.
See, we don't, with all respect, we don't agree with that. We don't agree with the idea that the insurance company should get to make that kind of decision about whether the lady goes home Thursday or Sunday. Now, I don't think that's intrusive. I think that makes common sense. But if we could find a way to bridge that gap, and I think we could, then I think the AHPs that you support aren't all that different than the exchanges that we do, and I would think that would be a common ground.
This has been a useful conversation. Paul Ryan wants to make a comment.
Can I just interject one quick point here, very quick, just in terms of trying to keep everything fair, which I know you want to do. To this point, the Republicans have used 24 minutes, the Democrats 52 minutes. Let's try to have as much balance as we can.
I think the Republican leaders are controlling the time for the Republicans, if I'm not mistaken. Is that right?
I don't think that's quite right, but I'm just going back and forth here, Mitch. I think we're just trying to go back and forth, but that's okay. Paul, I was about to call on you, if that's all right. Go ahead.
All right, Rob, here's basically what we're looking at. The difference is this. We don't think all the answers lie in Washington regulating all of this. So the problem with the approach we're seeing that you're offering, which I do believe, Senator, is very different than what we're saying, is we don't want to sit in Washington and mandate all of these things. So what you're doing is you're defining exactly what kind of health insurance people can have. You're mandating them to buy this kind of health insurance. And so we simply say, look, if the National Restaurant Association or the National Federation of Independent Business, on behalf of their members, wants to set up an association health plan, we think they'll probably do a good job on behalf of their members. Let them decide to do that instead of restricting insurance competition by federalizing the regulation of insurance and by mandating exactly how it will work. You make it more expensive and you reduce the competition among insurers for people's business. We want to decentralize the system, give more power to small businesses, more power to individuals, and make insurers compete more. But if you federalize it, standardize it, and mandate it, you do not achieve that. And that's the big difference we have.
Paul, would you yield? Mr. President, may I ask him to yield?
We're not in a formal hearing here, okay. So go ahead.
Paul, I read your roadmap, and I thought one of the things that you said is that there should be some minimum consumer protections in the exchanges that you propose. Did I get that wrong?
And there are in every state. And so what we're simply saying is, look, lots of us have offered lots of different ideas. We've got dozens of Republican ideas offered in the House in bills, in the Senate. And many of us look at the point of the fact that the states, do we distrust our governors? Do we distrust our state legislatures? Do we distrust all the state insurance? Yeah, okay, some of you may do that.
Depends on who it is.
But should we regulate all of this? Should people in Washington decide exactly how this works and what you can and cannot buy?
Paul,
there's just a difference in philosophy.
No. Look, I think this is an important point. We've got a couple other people who want to speak. We've gone about 45 minutes on this section. We're running over because we went long on the opening statements, and you're right. There was an imbalance on the opening statements because I'm the president, and so I made. I didn't count my time in terms of dividing it evenly. In this section, Mitch, we've gone back and forth
Senator
pretty
Schumer
well.
For the Senate.
I know Senator Schumer wants to speak, and I know that Jim Clyburn wants to say something very quickly, and may want to.
John Kyle would like to.
And John, but what I want to do though is just focus in on this philosophical debate. This is a legitimate debate, and it actually speaks to the point that Congressman Camp was making earlier about what's happening in the exchanges. When I was young, just got out of college, I had to buy auto insurance. I had a beat-up old car, and I won't name the name of the insurance company, but there was a company. Let's call it Acme Insurance in Illinois, and I was paying my premiums every month. After about 6 months, I got rear-ended, and I called up Acme and said, I'd like to see if I can get my car repaired, and they laughed at me over the phone because really this was set up not to actually provide insurance. What it was set up was to meet the legal requirements, but it really wasn't serious insurance. Now, it's one thing if you got an old beat-up car that you can't get fixed. It's another thing if your kid is sick or you've got breast cancer. So the general idea